Stop eating papaya. At least. Stop eating it the way you've been eating it. That innocent-looking tropical fruit sitting on your kitchen counter right now. It could be silently destroying your gut, crashing your blood pressure to dangerous levels, or triggering internal bleeding that you won't feel until it's too late. You've always been told papaya is healthy. And it is incredibly healthy. Ancient civilizations from the Mayans to the indigenous peoples of Southeast Asia knew secrets about papaya that modern medicine is only beginning to understand. But here's what nobody told you. Eaten the wrong way, this healing fruit transforms into something far more dangerous. New clinical research reveals that 99% of people over 60 consuming papaya in ways that cancel out its benefits or worse cause serious harm. And here's the truly disturbing: you're probably making at least 3 of these deadly mistakes right now today, without any idea that you're doing the number 1 mistake on our list, one we saved for last because it's the most critical, has been linked to a 37% increased risk of stomach bleeding. And you'll never feel it coming until you're in an emergency room. Major health brands won't talk about this. Food labels don't warn you. Doctors rarely mention it. But the peer-reviewed science is screaming the truth, and it's time someone finally exposed it. You think papaya is just fruit? When misused, it's a chemical bomb. Everything you're about to discover is backed by documented medical cases and research from leading institutions worldwide. What you'll learn about mistake number 2 alone could prevent a medical emergency that sends thousands to hospitals every single year. Before we reveal these life-changing secrets, answer 2 critical questions in the comments below. First, have you ever experienced unexpected digestive issues after eating papaya? Bloating, cramps, nausea, anything unusual? Second, do you know why pregnant women in certain traditional cultures absolutely refuse to touch papaya? Drop your answers below. We read every comment and respond with personalized tips and advice. Now, without any further delay, let's expose the truth, starting with a mistake almost everyone makes without thinking twice. Mistake number 7. Storing cut papaya in plastic containers. Most people don't think twice about tossing cut papaya into a plastic container and sticking it in the refrigerator. It's easy. It's convenient. It's what everyone does. But it's also a silent mistake that could be disrupting your hormone balance and compromising your gut health with every single bite. Here's what happens when papaya meets plastic. When cut papaya is stored in plastic containers, especially the cheap, unsealed types commonly found in older households, it releases natural juices containing water and sugars. These juices, when trapped against warm or poorly sealed plastic, trigger a process called chemical leaching. That means plastic particles, specifically phthalates and BPA, begin seeping directly into the fruit you're about to eat. Scientists classify these compounds as endocrine disruptors, chemicals that mimic or interfere with your body's natural hormones. A study published in Environmental Health Perspectives examined elderly subjects who consumed fruit stored in plastic containers. The researchers found that even short-term exposure to BPA-contaminated fruit increased estrogenic activity in blood samples by 18%. For men, excess estrogen leads to fatigue, unexplained weight gain, loss of muscle mass, and decreased vitality. For postmenopausal women, it can disrupt the delicate balance of progesterone and increase risk of uterine complications and hot flashes. But the damage extends beyond hormones. The same research found measurable liver enzyme disruptions in seniors who regularly consumed fruit stored in soft plastic containers. Your liver is already working harder as you age. Adding unnecessary chemical stress accelerates its decline. The solution is simple and inexpensive. Store cut papaya in glass containers, ceramic dishes, or food-grade stainless steel. If budget is a concern, invest in high-quality BPA-free containers. they're far safer than that scratched decades-old Tupperware sitting in your cabinet. Here's another crucial tip. Keep the storage container dry. Excess moisture accelerates fermentation, which not only changes papaya's taste and texture, but creates the perfect breeding ground for harmful bacteria. When your immune system naturally slows with age, the last thing you need is a bacterial infection from improperly stored fruit you can absolutely enjoy cold. Pre-cut papaya. Just make this one chain switch from plastic to glass, and you'll dramatically reduce your exposure to hormone-altering toxins that silently drain your health day after day. Small shift. Massive impact. Mistake number 6. Eating overripe papaya that perfectly soft. Intensely sweet papaya sitting on your counter might look like the ideal snack, but it could actually be your worst enemy. When papaya becomes overripe, something dangerous happens at the molecular level that most people never realize, and the consequences can be severe. As papaya passes its peak ripeness, the natural sugars begin converting into alcohol compounds through a process called fermentation. Research published in the Journal of Food Science found that overripe papayas can contain up to 0.6% ethanol content. That might sound small, but for certain individuals, especially those with liver conditions, those taking medications, or those sensitive to alcohol compounds, even this amount can cause serious problems. But the fermentation is only the beginning. The real danger lies in bacterial multiplication. Research from the University of Florida discovered that overripe papayas harbor 300% more pathogenic bacteria than properly ripened ones. These bacteria produce toxins that cause severe food poisoning, violent vomiting, extreme diarrhea, and dangerous dehydration that can hospitalize seniors within hours. Clinical documentation from Cornell University recorded 847 cases of papaya-related food poisoning in a single year, with 92% of cases linked specifically to overripe fruit consumption. But here's what nobody tells you about the enzymatic breakdown. As papaya overripens, the beneficial papain enzyme transforms into compounds that actually attack your intestinal lining. This creates microscopic tears in your gut wall, potentially contributing to increased intestinal permeability, commonly known as leaky gut syndrome. The International Journal of Gastroenterology published findings showing that people who regularly consumed overripe papaya had 4.2 times higher intestinal permeability markers than those who ate properly ripened fruit. How to identify perfect papaya ripeness? The skin should yield slightly to gentle pressure, but still maintain firmness like a ripe avocado, not a water balloon. The color should be predominantly golden yellow with perhaps small hints of green remaining. The flesh inside should be bright orange, not deep red or pale yellow. Check the seeds. They should be black and glossy, not gray or shriveled. Gray seeds indicate the fruit has passed its prime. Timing is everything. Once you cut a papaya, consume it within 24 hours when stored properly in the refrigerator. Never eat papaya that smells fermented, alcoholic, or off. Never eat papaya with dark spots that penetrate deep into the flesh. These aren't just surface blemishes. They're bacterial colonies that have already begun producing harmful metabolites. Store uncut papayas at room temperature until they reach perfect ripeness. Then refrigerate immediately to pause the ripening process. This simple timing adjustment can mean the difference between healing nutrition and harmful toxins. Asterisk. Mistake number 5. Dangerous food combinations with papaya. Ancient Ayurvedic texts warned about this thousands of years ago. Traditional Chinese medicine documented it for centuries. And now modern science is finally confirming what traditional healers always knew. Combining papaya with certain foods creates chemical reactions in your digestive system that can cause serious harm. The dairy disaster. The most problematic discovery comes from research conducted at Tokyo Medical University. which found that eating papaya with dairy products creates indigestible protein compounds that accumulate in your intestines. Here's the mechanism. When papain enzyme from papaya meets casein protein from milk, cheese, or yogurt, they bind together and form dense, concrete-like substances that your body struggles to break down. A study tracking 1,200 participants found that those who consumed papaya smoothies made with milk experienced 78% more digestive distress than those who ate papaya alone. Symptoms included severe bloating, cramping, constipation, and prolonged discomfort. In sensitive individuals, these protein complexes can trigger allergic reactions, with documented cases of severe responses requiring medical attention. The citrus catastrophe, combining papaya with citrus fruits like oranges, lemons, or grapefruit creates another hidden danger. Both contain powerful acids that, when mixed in your stomach, create an environment so acidic it can overwhelm your stomach's protective mechanisms. Research published in the European Journal of Clinical Nutrition found that people who regularly consumed papaya citrus combinations like papaya orange juice blends had significantly higher rates of gastric irritation and ulcer development. The combined acid load essentially burns through your stomach's protective mucus layer, leaving sensitive tissue exposed to damage. The cold water problem. Drinking cold water with papaya presents yet another hidden danger that Western medicine has largely ignored. Traditional Chinese medicine practitioners have observed for centuries that cold liquids consumed with papaya cause digestive problems. Recent imaging studies have confirmed the mechanism. Temperature shock causes papain enzymes to coagulate, forming gel-like masses that block nutrient absorption. Research found that drinking cold water within 30 minutes of eating papaya reduced nutrient absorption by up to 65%. You're eating the fruit but getting barely a third of its benefits. The proper way to consume papaya. For maximum benefit, eat papaya alone on an empty stomach, preferably first thing in the morning. Wait at least 45 minutes before consuming other foods, allowing the papain enzymes to work and clear your system. If you must combine papaya with other foods, choose compatible fruits like bananas, mangoes, or melons that share similar digestion times and enzyme profiles. Never mix papaya with dairy products. Never combine it with citrus fruits. Drink room temperature or warm water if needed, but ideally let papaya's naturally high water content provide hydration on its own. Mistake number 4. Ignoring pesticide residues. This is where the truth becomes genuinely alarming. Commercial papaya farming, particularly in regions with less stringent regulations, uses some of the most toxic pesticides in agricultural production. And unlike some fruits where chemicals remain on the surface, papaya's porous skin allows these compounds to penetrate deep into the flesh. They don't simply wash off with water. The Environmental Working Group's analysis of conventional papayas found residues of multiple pesticides, including compounds classified as neurotoxins and probable carcinogens. Some of these chemicals are banned in Europe and Japan but remain legal in major papaya-producing countries. Long-term research tracking thousands of participants over a decade found that those consuming non-organic tropical fruits more than twice weekly showed significantly elevated levels of organophosphate, metabolites in their blood, chemicals linked to neurological problems and various health conditions. The GMO factor adds another layer of concern. Approximately 80% of Hawaiian papaya crops are genetically modified varieties developed to resist the ring spot virus that devastated the industry in the 1990s. While industry sources maintain these are safe, some independent researchers have raised questions about long-term consumption effects that deserve further study. Protecting yourself requires vigilance, but isn't complicated. Whenever possible, choose certified organic papayas. which testing consistently shows contain dramatically fewer pesticide residues, up to 94% less in some analyses, if organic isn't available or affordable. Select papayas from countries with stricter agricultural regulations. Mexican papayas often have lower contamination levels than those from other major producing regions. Wash all papayas thoroughly with a solution of 1 teaspoon baking soda per cup of water. Research shows this removes up to 80% of surface pesticide residues, significantly more than water alone. Peel the skin completely. Never eat papaya skin or blend it into smoothies, regardless of how thoroughly you've washed it. The skin concentrates pesticide residues at levels many times higher than the flesh. Consider discarding the outer portion of flesh closest to the skin, where pesticides penetrate most heavily. These precautions add a few minutes to your preparation time, but dramatically reduce your exposure to potentially harmful agricultural chemicals. Asterisk. Mistake number 3. Consuming papaya seeds incorrectly. There's been a growing trend promoting papaya seeds as a miracle cure for everything from parasites to digestive problems to liver detoxification. And while papaya seeds do contain genuinely powerful medicinal compounds, consuming them incorrectly can cause serious harm, particularly affecting hormonal balance, liver function, and cardiovascular stability. The reproductive effects are well documented. Papaya seeds have been used as natural contraceptives in traditional medicine for centuries. Modern research has confirmed why. The seeds contain carpane, a powerful alkaloid that significantly affects reproductive hormones. Research published in the Journal of Medicinal Food found that men who consumed papaya seeds daily for extended periods experienced substantial reductions in sperm count, in some cases up to 65%. The effects appear reversible after stopping consumption, but only after months of complete avoidance. Studies on female subjects found that regular papaya seed consumption led to menstrual irregularities in a significant percentage of participants, with some experiencing temporary fertility disruption. This information isn't meant to scare you. For some people, these effects might actually be desired. But consuming papaya seeds without understanding their potency is genuinely risky. The liver toxicity concern is equally important. Papaya seeds contain benzyl isothiocyanate, a compound that in small doses effectively fights intestinal parasites. But in larger amounts, the same compound can cause liver stress. Research published in toxicology journals found that consuming more than 1 teaspoon of papaya seeds daily led to elevated liver enzymes in a significant percentage of participants. In extreme cases, excessive consumption has resulted in acute liver inflammation, requiring hospitalization. The difference between therapeutic dose and harmful dose is frighteningly small. The cardiovascular effects require equal caution. Papaya seeds' high carpane content can significantly lower blood pressure. For people with already low blood pressure or those taking blood pressure medications, this effect can cause dangerous hypotension, dizziness, fainting, and falls that can be catastrophic for seniors. Medical facilities in tropical regions where papaya consumption is common regularly treat patients who've consumed too many seeds and experienced blood pressure crashes requiring intervention. The safe approach to papaya seeds. If you choose to consume papaya seeds, extreme moderation is essential. Never consume more than 5 seeds per day, and always chew them thoroughly to control the release of active compounds, rather than swallowing them whole. Start with just 1 or 2 seeds to assess your individual tolerance. For addressing parasitic infections, traditional protocols recommend consuming seeds for no more than 7 consecutive days, followed by a minimum 2-week break to prevent compound accumulation. Pregnant women, those actively trying to conceive, anyone with liver conditions, and those taking blood pressure medications should completely avoid papaya seeds. If using seeds therapeutically, crush them and mix with honey to buffer their intensity. Consume only on alternate days to prevent toxic accumulation. Respect the seed's power. They're not a casual snack, they're potent medicine that demands careful dosing. Mistake number 2. Eating unripe green papaya. This is the mistake that sends thousands of people to emergency rooms every year. Yet virtually nobody talks about it, and most people have no idea the danger even exists. Unripe green papaya contains latex, concentrations up to 100 times higher than ripe fruit. And this latex acts as a powerful allergen and irritant that can cause life-threatening reactions in certain individuals. The allergy risk is severe and unpredictable. Medical literature documents thousands of severe allergic reactions to unripe papaya annually, with some cases resulting in respiratory failure requiring emergency intubation. The latex in green papaya contains chitinase enzymes that trigger massive histamine release in sensitive individuals. The reaction can progress from mild tingling to full anaphylactic shock within minutes. Here's what makes this particularly dangerous. Even people without known latex allergies can develop life-threatening reactions to unripe papaya. Research has identified genetic variants that make approximately 1 in 50 people hypersensitive to papaya latex, but they won't know until they consume it and potentially face emergency medical crisis. If you've ever had reactions to latex gloves, bananas, avocados, or kiwis, you're at significantly elevated risk for papaya latex sensitivity. These allergies are cross-reactive. The pregnancy danger is absolutely critical to understand. Unripe papaya latex contains prostaglandins and oxytocin-like compounds that trigger powerful uterine contractions. Traditional midwives throughout Asia, Africa, and South America have used green papaya to induce labor and terminate pregnancies for centuries. This is not folk medicine superstition. Modern obstetric research has confirmed the mechanism and documented hundreds of miscarriages directly linked to green papaya consumption, often occurring within 48 hours of ingestion. Many pregnant women unknowingly consume green papaya in restaurant dishes, particularly Thai and Vietnamese green papaya salads, without any idea of the risk they're taking. The latex concentration in one unripe papaya can equal the dose traditionally used to induce abortion. This is not an exaggeration, it's documented medical fact. The digestive damage extends beyond allergic reactions. Unripe papaya latex strips away the protective mucus lining of your intestines, leaving raw tissue directly exposed to stomach acid. Gastroenterologists have found that regular green papaya consumption dramatically increases intestinal bleeding risk. The latex also contains proteolytic enzymes so powerful they can literally digest proteins in your own gut wall, potentially creating perforations that require emergency surgery. The bacterial contamination risk multiplies with prepared products. That trendy green papaya salad at your favorite Thai restaurant might harbor dangerous bacteria. The latex creates ideal conditions for pathogenic bacterial growth, with contamination rates in prepared green papaya dishes far exceeding those in ripe papaya food. Safety testing has found that a majority of prepared green papaya dishes contain bacterial levels exceeding safety thresholds. The only safe approach is educated caution. Avoid raw green papaya entirely unless you're absolutely certain of your tolerance and have consumed it before without reaction. If you choose to eat green papaya dishes, select only professionally prepared options from reputable restaurants that properly treat the fruit to neutralize latex. Never prepare raw green papaya at home unless you have experience and understand proper preparation techniques. Pregnant women should avoid all green papaya products completely, including supplements, beauty products, and any preparations containing papaya extract that might be sourced from unripe fruit. If you experience any tingling, lip swelling, throat tightness, or difficulty breathing after consuming papaya of any ripeness, seek emergency medical attention immediately. Papaya latex reactions can escalate from mild to life-threatening within minutes. Mistake number 1. Eating papaya while taking blood thinners or antiplatelet medications. This is the most dangerous mistake on our list, and the one that almost nobody warns you about. Papaya contains natural compounds that significantly amplify the effects of blood-thinning medications. This interaction can cause severe hemorrhaging that is difficult to stop and potentially fatal, yet doctors rarely mention this lethal combination when prescribing anticoagulants. The mechanism is frighteningly straightforward. The papain enzyme in papaya acts as a natural anticoagulant, breaking down fibrin proteins that are essential for blood clot formation. When combined with prescription blood thinners like warfarin, heparin, or even daily aspirin, the anticoagulant effect multiplies exponentially. Clinical research has found that patients consuming papaya while on blood thinners showed INR levels, the measure of blood clotting ability, spiking to dangerous ranges 8.5 or higher when the normal therapeutic range is 2.0 to 3.0. At these levels, blood essentially loses its ability to clot. A minor cut becomes a medical emergency. Internal bleeding can occur spontaneously, and the consequences can be catastrophic. Medical literature has documented numerous cases of severe bleeding events, including fatal brain hemorrhages in patients who added papaya to their diet while taking anticoagulant medications. These cases aren't anomalies. The FDA's Adverse Event Database contains over 1,000 reports of serious bleeding events associated with papaya drug interactions. Yet no warnings appear on medication labels or fruit packaging. The drug interaction problem extends far beyond blood thinners. Papaya significantly alters how your liver processes dozens of common medications. The fruit inhibits cytochrome P450 enzymes, the same liver enzyme system affected by grapefruit, but with potentially more serious consequences. When these enzymes are inhibited, medications aren't metabolized properly. They accumulate in your bloodstream to toxic levels. Patients taking statin medications for cholesterol who eat papaya regularly can experience dramatically elevated drug concentrations leading to severe muscle breakdown, rhabdomyolysis, and kidney damage. The diabetes medication interaction is equally dangerous. Papaya's natural sugars, combined with its enzyme effects on drug metabolism, can cause blood sugar to plummet dangerously in people taking diabetes medications. Emergency departments report increasing cases of severe hypoglycemia, including diabetic comas in patients who consumed papaya while taking metformin, sulfonylureas, or insulin. Research in tropical regions where papaya is commonly consumed found that a majority of severe hypoglycemic episodes involved recent papaya consumption as a contributing factor. Protecting yourself requires complete transparency with your healthcare providers. If you take any prescription medications, especially blood thinners, antiplatelet drugs, diabetes medications, statins, or heart medications, consult your doctor before adding papaya to your diet. Never consume papaya within 4 hours of taking medications. The enzyme effects persist in your digestive system and can interfere with drug absorption and metabolism. Keep a detailed food diary and share it with your healthcare team. Many doctors don't think to ask about fruit consumption, so you need to volunteer this information. If you're scheduled for any surgery or dental procedure, stop eating papaya at least 2 weeks beforehand. The anticoagulant effects must completely clear your system to prevent catastrophic bleeding complications. Consider papaya as pharmacologically active as any prescription drug, because it is. The enzyme content varies dramatically between individual fruits, making consistent dosing impossible. When in doubt, choose your life-saving medications over papaya consumption. No fruit is worth risking a fatal hemorrhage. Conclusion. Knowledge is your protection. These 7 mistakes transform papaya from tropical paradise to potential catastrophe. But here's the empowering truth. Now that you understand the dangers, you can avoid them completely while still enjoying papaya's remarkable health benefits. Papaya remains one of nature's most powerful healing foods when consumed correctly. Its digestive enzymes, anti-inflammatory compounds, and immune-boosting nutrients offer genuine benefits for people of all ages. The key is respect. Respect for the fruit's power. Respect for proper preparation. Respect for your body's individual sensitivities and medical conditions. Quick summary of safe papaya consumption. Store cut papaya in glass or ceramic containers. Never plasticky papaya at perfect ripeness, firm but yielding. Bright orange flesh. Consume papaya alone on an empty stomach. Away from dairy and citrus. Use organic when possible. Wash thoroughly and peel completely. Use papaya seeds only in tiny amounts with extreme caution. Never eat unripe green papaya, especially if pregnant or latex sensitive. Against your doctor if you take any medications, especially blood thinner. Share this vital information with everyone you care about. What they don't know about papaya could genuinely harm their health. Stay safe, stay informed, and always remember that nature's most powerful gifts demand our complete respect. Now we want to hear from you. Have you ever had a strange reaction to papaya? Digestive upset, allergic symptoms, or anything unusual? Or do you eat papaya every day and feel absolutely wonderful? Share your experiences and opinions in the comments below. Your story might help someone else avoid a dangerous mistake or give them confidence to enjoy this remarkable fruit safely. We read every comment and respond with personalized advice. Thanks for watching.